Hi guys, welcome back to my channel. If you're new here, please go ahead and subscribe. If you're not new here, thanks for stopping by. So today I want to talk about contraception and answer a question that is commonly asked by females, and that is, how soon after contraception will my period go back to normal? This is a question that I commonly get from females, so that's what we're going to talk about today. The first one we're going to talk about is the Depo-provera injection, right? The Depo-provera injection, it's pretty common. I'm sure most of you guys know it. It's administered under the skin subcutaneously every 12 to 14 weeks or every 3 months. For women who are sexually active, who have regular menses, it should be administered during the first 5 days of normal menstrual period. If you're breastfeeding, then your first injection should be administered during or after your 6th postpartum week. This form of contraception is also not recommended for long-term use. So use more than 2 years is not recommended unless other methods of contraception have been deemed inadequate, or you're using the Depo-provera injection for other indications, for example, endometriosis associated pain. In that case, your options are limited. Otherwise, this form of contraception is not recommended for long-term use more than 2 years because of a potential risk for depleting your bone mineralization and all of that. We're not getting into that, but I'm just telling you guys about some of the possible concerns with the Depo-provera injection. After stopping the Depo-provera injection, your menstrual cycle is expected to go back to normal within a year. Could be more, could be less. So it can take anywhere between 6 to 24 months, but for most women, their cycle goes back to normal within a year. The contraceptive implant, like the Nexplanon or Implanon, is the most effective form of reversible contraception. It is inserted under the skin or subdermally of the upper arm usually. This insertion must take place in a doctor's office. So your physician or other trained health professional must do it for you. One of the things I really like about the contraceptive implant is its ease of insertion and removal. Not time consuming, does not take very long, right? Depending on the skillfulness of the person, it can take between like 5 to 10 minutes. Once it has been inserted, it will begin to release ovulation suppressing hormones, and this can last for up to 3 years. If after your first 3 years you decide to discontinue using the contraceptive implant, your period should return to normal within 3 to 4 weeks. Also, with the contraceptive implant, once you put it in, that's it for the next 3 years. Unlike the pill that you have to take every day, or the injection where you have to get it every 3 months, with the contraceptive implant, once you put it in, that's it for the next 3 years. So that's another thing I like about the contraceptive implant, and this is one of the things that a lot of women like about it as well. Next ones we're going to look at are the intrauterine devices, or your IUDs. You have the hormonal IUDs like your Mirena that provides contraception for up to 5 years. These devices are placed inside the uterus where they release progestins. Progestin is going to provide contraception by thickening the cervical mucus and reducing sperm motility. It also renders the uterine lining less ideal for implantation as it thins the endometrium. This mechanism of action is actually utilized for persons who suffer from heavy menstrual bleeding or abnormal uterine bleeding. Now, after removing your IUD, your hormonal IUD, it can take approximately 3 to 6 months for your period to go back to normal. So it doesn't take very long for your period to go back to normal, and this is because the hormones that are released by your hormonal IUD, these hormones are localized to the uterine area, right? So it's not going to take very long for your period to go back to normal because it's not systemic, right? And this is similar to your contraceptive pills. You should expect your period within the next 3 to 6 months after you've taken your last hormonal pill or after you've discontinued taking your contraceptive pills. And we know what contraceptive pills, you want to start taking your contraceptive pill between day 1 through to 5 of the start of your normal menstrual cycle, right? This is one of the most common forms of contraception that is utilized by women, right? It's a little bit more, it requires a little bit more attention. Some women, I usually tell my patients to set an alarm on your phone, or you take your pill around the same time that you'd normally do something that you do every day. So, once you're doing that thing, you automatically remember to take your pill. Another form of intrauterine device that I forgot to mention is the copper intrauterine device or the copper IUD. This IUD provides contraception for up to 10 years, and it does this by releasing a small amount of copper into the uterus, and this prevents fertilization of an egg, or it prevents implantation of a fertilized egg. It may also interfere with the sperm's ability to get to the egg to fertilize the egg. With this form of intrauterine device, ovulation continues as is, so your menstrual cycle is not interrupted because it does not contain hormones. In fact, what it usually causes is heavy menstrual bleeding or painful menstrual bleeding, and those are the two main reasons why women would normally remove their copper IUD, because of those side effects. So once you've removed your copper IUD, your menstrual cycle was not interrupted to start with, so you can try to become pregnant immediately after. Guys, if you have not already subscribed to my channel, this is your chance to do so. Please turn that post notification on. Hope that you guys learned something from this video, and I'll see you next time.